Good afternoon. This is Mike Patronis, CEO of Spring Hill Medical Center, and I'm with Pete Johnson, and we're going to give you a COVID vaccine update. Take it away, Pete.
Okay, so right now we're busy registering everyone for Thursday's vaccine. We received 375 doses. We'll be getting those out on Thursday. The number to call, 539-1703, is up here. We also have registration on the computer where you can go online and do it, which will be quicker than trying to call in because you can see what spots are available and sign up that way. I want to remind you that if you come for your vaccine, you must bring, well, Mike's going to go through all the requirements, but you must bring your identification to make sure that we know that that you fit into what the government says that we need for you to get vaccinated. Also, please don't show up more than 10 minutes early. We're trying to keep space so that it's COVID safe, and we need to not have everybody crammed in. If you're signed up, you will get your vaccine, so please don't come too early, and that'll help us get through the process. Now Mike is going to talk about who can get it and what you need to bring to show that.
So the governor's office earlier today sent out an update, and so the Louisiana Department of Health update specified that it's still the ages of eligibility of 78 years or older. And then there's two other categories that we want to make sure we're very clear about, and that's patient status eligibility. If you're home care patients and their providers, that includes older and younger people with disabilities over the age of 16 who receive community or home-based care and their providers, as well as clients from home health agencies. Also dialysis patients and providers. Included in a provider group eligibility is ambulatory care providers and their staff. This includes members of coroners, autopsy, or mortuary teams who have direct contact with corpses, urgent care clinic providers and their staff, school nurses and school board health center staff, community clinic providers and staff. This includes staff of clinics designated as federally qualified health center and rural health clinics, staff of home health agencies, staff providing community and home-based care to older adults and people with disabilities. This includes staff employed by home care agencies as well as staff who are hired directly by the person with a disability, behavioral health providers and staff, dental providers and staff. This includes all oral health providers, students, residents, faculty, and staff of schools of allied health. We're going to post this to our website, and so you'll have this to key you in. Our website's going to have a register for vaccine button right here. It gives you a little bit of detail. We have a phone number that you can call from 8 to 12 and from 1 to 5, and that's listed there as well. And if you're going to register, this is what it looks like. It's going to give you a time slot. The only day we have available is the 21st of January right now. The time slots that are still available for that day, as you can see here, a lot of the times have already been absorbed. We only opened the site up last night and put the number out last night, so they're being taken up very quickly. But that's what that looks like. When you go to sign up, you can pick a time, scroll down, put in your name. Your email is optional and your phone number is optional, but it should allow for texting an email of an update to you. And address is certainly optional. We don't need the address. And then if you have any special notes, if you have any special concerns that you want us to address, you can put them there. We may or may not be able to use that text box. And then you book your appointment and it sends you an email if you place your email in there, and it's as simple as that. So other than that, just some things to be thinking about as you come to the visit. Patient must show proof that they are receiving home-based care or receive regular dialysis care. The state has provided people with disabilities a qualification letter from the state health officer. Other forms of verification may be acceptable as well, such as the person's plan of care for community and home-based services. Another note about employment: you need proof of employment, such as an employee ID or name tag, pay stub, with your letter from the employer as applicable, your uniform, parking pass, or any other form of ID that's acceptable to the vaccine provider. Basically, bottom line, just prove who you are as a qualified worker or staff member and bring that with you to the visit. And if you're of age, 70 or greater, just have your driver's license with you.
And it was clarified for us today that you must be 70 of that day that you're receiving the vaccine. So If you turn 70 on Thursday, you're good. If you turn 70 the next day, we can't do that. We'll have to catch you the next time. And that's the other thing. Don't get worried if you can't get on here, because we do expect more either next week or the next week. This is going to be a continual process. This is not a one-time deal. We're going to get more.
So this is why you're hearing from Pete and I daily on this channel. We're posting these videos up on our website so you can know what's going on currently, and you can also see some of the past and how we worked up to it. But the bottom line is the federal government, the state government are all trying to get vaccine out into our communities as quick as possible. They're working centrally through our hospital systems, but they're also working through pharmacies. So you may be able to pick up a vaccine through your local pharmacy or through our system at the hospital. For us at the hospital, your conduit to keep up to date is going to be our website, and you can register through there, as well as give us a call if you need to call us. Like Pete said, we requested a certain number of vaccine, and we got half of that. Today on the call with the state government, they're only able to supply about 20% of the demand that's been asked for. So I do feel like this is a definite rollout as quick as we can, but it's a little slower rollout than what the population would like to see. So just stay tuned. I'm sure we'll continue to get plenty of vaccine, and as we get that vaccine, our